Good evening, ladies and gentlemen. Again, thank you for being with us this evening. I'm reporting this evening an additional 401 new cases of COVID-19 diagnosed in the last 24 hours, bringing the total number now diagnosed in this country through all labs to 15,652. That's 15652. Also reporting that we've been notified today of 77 additional deaths, bringing the total number to 687 notified. 67 of those additional ones are in the east, 4 in the west, 4 in the northwest, and 2 in the south. The male-female breakdown, 31 males, 42 females. It doesn't quite add up. We haven't had notification of in 4 of the cases. The median age is 84. And in 54 of the 77, we have reports of an underlying medical condition. Of the now total 687 deaths, 348 were hospitalised at some point. That's 51%. 7% or 45 were admitted to intensive care. We have reports of underlying medical conditions in 564. That's 82%. The male-female breakdown is 377 males, 306 females. That's 55% to 45%. The median age of all those deaths is 83, and the mean age is 69, and the range is from 23 to 105. And again, I'd like to take this opportunity to express all of our condolences to the families, to the friends of each one of these individuals. In terms of the more detailed breakdown of cases notified to us by midnight Saturday night, that was 15,185 cases. 2,272 had been hospitalised. That's 15% overall, a slight reduction. ICU admissions were 306. That's 2%, again a slight reduction. The number of deaths reported at that time was 642. That's 4.2%. There were a total of reported clusters of 478, accounting for 3,139 cases. The percentage that were healthcare workers is 26%, and the median age overall is 46. In terms of a more detailed breakdown of 307 admissions to date of intensive care admissions, 152 remain in intensive care. That's 50%, again a slight reduction. The total number now discharged from an intensive care unit is 109. That's a percentage of 36%. Of the 45 deaths in intensive care I mentioned earlier on, 15% of those were ICU admissions. The median age overall was 60, and 82% or 252 we have reports of an underlying medical condition. I'm now going to come to my colleague, Dr. Kathleen McClellan, Head of Social Care here at the Department of Health, just to give you a little bit more detail in relation to community residential settings. Kathleen.
Thank you very much. Good evening. In relation to long-term residential care settings, the number of confirmed cases are 1,761, and for nursing homes that's 1,204. The number of total deaths in long-term residential care settings are 406, and for nursing homes that's 337. For the first time we can separate these out to lab-confirmed deaths and probable or suspect deaths. So in terms of the total deaths for long-term residential care settings, there's 329 lab-confirmed deaths and 77 probable or suspect. In relation to nursing homes, there's 276 lab-confirmed deaths and 61 probable or suspect. We announced on Friday night last that we were doing a census of mortality across long-term residential care settings. That census commenced over the weekend across all mental health, intellectual disability specialist services and nursing homes. That census has had a very high response rate, and we're working on putting together the information from that. There's still information coming in, and we would hope to have further information back around that census of mortality in the next few days. That information will give us a stronger sense of the pattern of mortality and the disease progression across our longer term care settings, and they will help direct our public health and our other clinical actions across these settings.
Thank you very much, Kathleen. Now we're happy to take any questions you may have. Sarah?
Yeah, Sarah King, Virgin Media News. We saw today reports about the possibility of further waves and that we're a long way off the term normality, I suppose, until we get a vaccine. I understand there might be an update on vaccine tonight that you were... had for us?
No,
No?
you know something on?
No, there isn't an update in particular, but
Okay.
this is European Immunisation Week, which I'd alluded to in the press statement. So I suppose it's very important in the context of COVID-19 that whilst obviously a lot of our focus is on that, we really can't lose focus on other infectious diseases that represent a significant threat to the most vulnerable in our society, whether that's measles or mumps, for example. So I guess I just took the opportunity in the press release to highlight the importance. Our national immunisation programme is still operating. Babies should still be getting all of their routine vaccinations. And really I'd urge parents to contact their GP and ensure that they get the vaccinations as and when is appropriate.
Okay. Tony, can I just ask you, obviously 77 deaths notified today is a huge jump from the last largest figure we had. Was that predictable, do you think, or did we know that we would see this happen in the trend? Did we see this coming?
So that is notifications as opposed to deaths. And I have some graphs here that will show you. They didn't all occur in the last
No,
short
I know
period of
that,
time.
yeah,
So it's
yeah.
just worth bearing that in mind. Sometimes it takes a period of time for a death after occurring to get notified, and it has to get notified in the first instance to the relevant public health departments, who then have to enter it onto the system that we have for collecting all the information related to all infectious diseases, which is the so-called CIDR system, the Computerized Infectious Disease Reporting System at the HPSC. That gets uploaded, and then we get a report based on that. That there is a distribution just by date of death of the people, the 77 today, and you can see that over a period of time. And I'm straining to read the dates in my but I'm sure you're younger than I am, you'll be able to see them.
Yeah, no, we can see it.
So
There was a graph last week on Friday you've given us, which was quite good.
I'm going to show you that
Yeah.
equivalent graph as well, but you can see that from the 2nd of April, where you've got a case, the 3rd, the 4th and the 5th, and then 2 cases on the 8th and so on, all the way up to the largest number of deaths on a given day of the 77, as you can see, and the report is the date of the 18th, thank you. So you can see that number there. And so you can see that, in fact, 77, although they're notified to us in one go, they didn't all occur in the same time period. So it's worth bearing that in mind when you're interpreting it. I'm not saying you would misinterpret that, sorry, but that there is essentially the equivalent of what I would have, the number of deaths overall for all deaths notified to us. I've just put the last few in red because I want to make the point again that there's a lag time, so you can't be certain that that's the total for those days. There may well have been people who died in those days where just the process of getting notified and getting updated and so on hasn't been complete for those days, so don't conclude that that's a drop-off, and I would have made that point when we had that graph or equivalent graph on Friday. And you'll be familiar with this concept of the percentage rate and growth. So if you look at the change in the number of deaths by date of death over a period of time, this one is representing the percentage growth in the number of deaths on a given day, and you can see that that's been falling. And just I've again put the last few days in